Doctor, my lips are tingling and my hands feel strange.
Dr. Hee Mun, what's happening to her?
My hands, I can't relax them.
Dr. Hee Mun, is this a stroke?
Don't jump to the diagnosis, Luna. Think like a doctor. Ugh. What major complication you always think about after thyroid surgery? Luna, what electrolyte abnormality comes to mind?
Could it be hypokalemia?
A good thought, but does hypokalemia explain her recent thyroid surgery?
Hypocalcemia!
Good. Now recognize severe symptomatic hypocalcemia requires immediate IV calcium. Luna, let's see what's happening inside her body.
The nerves are firing non-stop!
Exactly. Calcium stabilizes nerves, muscles, and the heart. When calcium falls, every one of them can be affected.
Now I understand symptoms. So the patient has hypocalcemia?
Not so fast. Before calling it hypocalcemia, check two things: albumin and the acid-base status. She's hyperventilating after an anxiety attack. Her pH is 7.56, but she's developing carpopedal spasms. What could explain her symptoms? Dr. Hee Mun, her total calcium is normal.
Why is she having symptoms?
Alkalosis increases calcium binding to albumin, lowering the ionized calcium.
So total calcium doesn't always tell the whole story.
Before searching for the cause, confirm true hypocalcemia. Correct for albumin or measure ionized calcium. Why is PTH the next test?
Because it tells us where to look next.
A low PTH means the parathyroid glands aren't responding. A high PTH means they are.
So the parathyroid glands aren't responding?
Right. When calcium is low, PTH should rise. If it doesn't, think hypoparathyroidism.
So the surgery damaged the parathyroid glands.
Without enough PTH, the body can't maintain a normal calcium level.
So thyroid surgery isn't the only reason PTH can be low?
Let's look at 3 other important causes of hypoparathyroidism.
The immune system is attacking the parathyroid glands.
Without enough PTH, the body can't maintain a normal calcium level.
So the patient is born without normal parathyroid glands?
That's right. Without functioning parathyroid glands, PTH stays low, leading to hypocalcemia early in life.
So the parathyroid gland needs magnesium to release PTH?
Exactly. When magnesium becomes severely depleted, the gland can't release enough PTH, even when calcium is low.
I've been drinking heavily for years, now my muscles keep cramping.
I've had severe diarrhea for now my hands keep cramping. Luna, but could it be the same diagnosis? What's the most likely cause?
3, 2, 1.
Chronic alcohol use can cause severe magnesium deficiency. Severe diarrhea can also cause major magnesium loss.
Excellent reasoning, Luna.
If PTH is high, the parathyroid glands are responding normally.
Right. Now we need to find out why calcium is still low.
Which vitamin D test should we order?
Measure 25-OH vitamin D. It's the best test for diagnosing vitamin D deficiency.
So the parathyroid glands are working, they're trying to compensate.
The problem isn't PTH. The body can't absorb enough calcium from the intestine. Vitamin D deficiency is a common cause of secondary hyperparath. Can you think of another?
Chronic kidney disease.
CKD also causes cechism, but through several mechanisms.
Damaged kidneys can't activate vitamin D.
Without enough 1-alpha hydroxylase, less active vitamin D is produced.
The kidneys can't activate vitamin D.
Less active vitamin D means less calcium absorption, so the parathyroid glands increase PTH.
Why does chronic kidney disease cause phosphate to build up?
Damaged kidneys can't remove phosphate. The excess phosphate binds calcium, lowering free calcium and increasing PTH.
Why do the parathyroid glands become enlarged?
Because the calcium stays low for a long time, eventually becoming enlarged. This is called secondary
What happens if secondary continues for years?
The enlarged glands can become autonomous, producing PTH without normal feedback. That's tertiary hyperparathyroidism. We've covered CKD, Can you name some other important causes of hypocalcemia with an elevated
Acute pancreatitis, massive blood transfusion, and hungry bone syndrome. Why does pancreatitis cause hypocalcemia?
Inflamed fat releases fatty acids that bind calcium. This process, called fat saponification, lowers the... After a massive transfusion, what substance in stored blood can lower calcium?
Citrate.
Exactly. Citrate binds free calcium, lowering the ionized calcium level. After surgery, why might calcium become very low?
Bones are taking it up.
Exactly. They rapidly absorb it from the bloodstream. Why do the bones suddenly become so hungry after parathyroid surgery?
Because years of excess PTH weaken the bones. They rapidly rebuild and pull calcium back.
Can you summarize the causes of hypocalcemia with an elevated...
Vitamin D deficiency, chronic kidneys, acute pancreatitis, massive blood transfusion, and hungry bone syndrome.
Luna, let's assess these two new patients.
I've been on dialysis for hands keep cramping. The pain is unbearable. It goes straight through to my back.
Notice the tingling and cramps? What's your diagnosis? Both patients have hypocalcemia. Identify the cause. Pause the video if you need more time.
Less active vitamin D and phosphate retention. Acute pancreatitis, calcium becomes trapped in fat.
Excellent. Different mechanisms, same hypocalcemia. Can you summarize the first steps?
Treat emergencies first, then confirm true hypocalcemia before measuring PPH.
What does the PTH tell you?
A low PTH points to hypoparathyroidism. A high PTH means the glands are responding, so I look for the underlying cause.
What's the most important lesson from today?
Don't memorize causes, understand the physiology,
And the diagnosis will follow. That's how we think like a doctor.
so we just replace calcium and we're done?
Not always. Sometimes, the real problem isn't calcium, it's magnesium.